know that because I was born here, right? Actually, I was born in this apartment, actually. And this is how it looks like here. This is how it looks like, right? This is the business center district right here. This is the metro. And this is basically where residential area is, right? I actually go to this kindergarten and this school. It doesn't show here. But anyway, it's not important. Remember what Benny said about the residential committee? It's right here. What they do is they collect they have all the information about everybody living in this district. So what's their age, what's their income level, all their information. So we're gonna partner up with the first person we're gonna go to is them, right? We're gonna ask them, okay, how many old people you have, right? How many people you have, and what is their health status, right? And we're gonna have a sort of like a checkup date. Set up a checkup date with them, and they're gonna pretty much spread out the words to everybody, all people here, and telling them to pretty much come here at this time. So we're gonna drive around here to here and do our checkup. So to make sure there is non-repeating members, right? Non-repeating members here, and we are going to just doing repeating jobs in the next day and the next month. So that's basic idea. Yeah.
So why do you think the old people gonna buy in your service?
It's free.
What's their
Because
It's free.
it's easy.
It's free.
And
We
also
go to them. It's free. Why not?
what's their motivation like? And they
Basically-
say they trust the state hospital and they don't trust local or city
Would you-
level hospital.
So
and
here's a
then
question.
It
Why
will
would they
limit
wanna
their
do it?
effort to go to they do not have to go anywhere. They
Yeah.
just waiting for the fan to come,
Mhm.
and then it's easier for them. Remember, they're old, so their mobility might be limited. So
Yeah.
it's actually make it way more easier.
There is
for
no
them.
such thing as preventive service in China
Yeah.
at this
Right.
point.
Mhm.
Would you rather waiting on this line, or we come up to
Yeah,
it?
or
But they try. I mean, inside their mind, they said, "I'm going to some. I'm going to see some very qualified, very well-known, with high reputation doctors. They trusted them. They don't trust your small van. So how do you build your brand?
No.
Say our van is trustworthy.
Yeah,
I should
so-
come to see you.
Yeah, so remember our objective here is to provide preventive care.
Right.
So we will not accept patient that have like cancer, 4-stage cancer,
Yeah.
and we will refer them to the state hospital for that. But our goal is the preventive care. So with the preventive care,
What is exactly included in the preventive?
Blood pressure.
blood pressure, annual checkup.
Have you ever done any checkup?
Vitals or like just
Yeah.
basic vitals.
Needle, collecting your blood sample.
Mm-hmm.
So the core of our business is really the data. That's the core value of our business is that after 1.5 year benchmark, after 1.5 year milestone, we're gonna have at least 1.5 million people's data blood sample, and they don't have the data infrastructure.
How do you prevent the moral hazard? You are increasing patients to the hospital.
We're not
Because
increasing
you're checking more people and find out they have immunity or not,
Mhm.
and you refer them to one hospital.
Yeah, what's the moral hazard here?
Moral hazard.
Yeah, what's the moral hazard here?
Yeah.
Like if you just exaggerating the situation of the patients, just by
We're not for profit, so we are not making money by referring, nor not making money by not referring. So I don't see the moral hazard here because
No,
we're not manipulating the data.
No, I'm saying like maybe you are not, but how do you prevent your employee?
Uh-huh.
I think if I may just comment, I think his question, if I got him right, is that the hospital already has like a certain number of turnout on a daily basis, and then
Discover more
and
patients.
that turnout is actually based on the number of people that walk in, just like the video show. The number of people that walk in the registration and then have that sort of appointment, do that live with the hospital. So they run a database based on the information they get from their individual departments. But if you're going to be making your daily referral to add on to that number of referrals, that create burden on the hospital. So you cannot like do exactly what you're trying to prevent. that's number one.
Mm.
And another side to look at it is why do you think people like prefer coming to you when in fact they know that like going to the hospital, even though you're gonna say we want to do a checkup, all of that, but the hospital also give preference to people who are within their record. So how will you ensure that the hospital create this partnership with you that
Hospital don't have. By the way, hospital don't have the record.
So who has
There is a lack of data infrastructure in Chinese hospital. It's very disorganized,
Okay.
and everything was done on paper.
Okay.
They give you paper prescription,
Mhm.
prescription,
Mhm.
and it's not really computerized.
Oh, okay.
When was the last time? When was the last time in China? I was going to the doctor.
Yeah, yeah.
So I see that the community you're targeting is like in big cities.
Right.
Have you thought about going to like elder community or like
Right.
lower tier cities?
Yeah. So the reason we choose the tier 1 city is because they have better infrastructure. It will reduce our cost in the first place. If you go to a tier 3 city, they might have a poor condition, and there are more people needs help, but the hospital don't have the same access of resources, and without those resources, infrastructure is just insignificantly increase our cost. So that's why we choose top tier cities. Better transportation, better road condition, better, easier to find volunteers, easier to find the local doctor, easier to partner with the local hospital, and all that will reduce our cost.
Your mission is trying to reduce the gap between the first tier cities and second tier, but you are providing services to first tier
So,
cities too, and
so
then
remember,
that's not really.
so remember the mission. We have 2-tier mission, right? One is I'm trying to get back, but I don't know why.
Your computer's gonna die,
Is-
die.
It is going to die.
It's gonna die.
Can somebody grab Will to get a charger? Just grab Will. So we have so if you here actually you have 2-tier system, right? One is long term and one is short term. The long term is to ultimately solve the entire distribution problem. But in terms of short term, remember there's also a uneven distribution of resources within big city between local hospital, community hospital, and the state hospital. Right? So that's our short term goal. You're not gonna solve that inequality in 1 year. Any question?
Also, at least this is what we will do as a pilot for a year. It will be in Shanghai, but moving forward, we will go to rural areas.
So I just don't see the specific plan of your land here, like including like how do you recruit the employees, doctors, or volunteers.
So we're not recruiting employee in the first interview. I blame you, David Siegel. I mean Professor Siegel, because we only have 10 slides. Anyway, so the plan is that we are going to partner with local medical school, right? The medical school have medical students, and they have semi-pro ability to do checkup, I guess.
So you're
Doing
cutting out
the
your
blood pressure and heights and collecting the blood sample. So 3 volunteer, 1 licensed profession from the local hospital.
But you put your reputation at stake.
Huh?
I said you put your reputation at stake because you're talking about.
We have no. We start from scratch, so there's no reputation at first. We have nothing to lose. It's easy then.
And
You're talking about the medical school students.
On a serious note though, that's why we have 1 profession.
Yeah.
We have 1 licensed profession, doctor from local hospital or nurse.
They will
From
be
hospital.
supervised by the
They will.
professional.
They will be supervised by the
And
professional.
basically, how else we can create a better doctor? that student, they will become a doctor in the next 10 years.
I know,
or
but you
the
need to know
95
that
years.
they need a long time, like,
Yeah,
residency.
and this
Probably
can
like
be
50
their also
years.
their practice because it's not hospital. They will not operate. They will just do a preventive care. That's what I'm saying here.
Pretty much, yeah.
Yeah.
Yes, so
There's no, by the way, there's no clinic in China. There is a lack of probably private clinic I can think of, but those are very expensive and 95% more people don't really go to clinics. They go to hospital. But as you can tell, the waiting line on the state hospital is too long. People don't go to community hospital because the resource and everything, all the concerns, they don't really trust the local hospital.